Hi, I'm Sarah. I'm one of the vets at Prize Farm. Today we're going to be going through a little bit about first aid, how you can help your horse and how you can help us help your horse if the worst happens. So things that we're going to go over in this presentation are the approach to an emergency, any useful equipment that might help you out, a good basic first aid kit. We're going to cover wounds, we're going to cover lamenesses, a bit about colic, we're going to look at some sore eyes, choke, and then foot penetrations at the end. And then, just in case anyone is a bit squeamish, there will be some pictures of wounds with a bit of blood and gore, just to keep you aware. So it's often worrying to turn up to the yard and find that your horse is in distress, has had an accident, or is not happy. The best thing that you can do in this situation is stay calm. We know it's very difficult to do, but if you can stay calm, that means that you will help your horse stay relaxed, and it also means that you can communicate efficiently with us, with friends that you need to help out, and hopefully get the situation resolved as quickly as possible. Some people are not good in a crisis, that's absolutely fine, and we don't expect people to be cool, calm and collected if their horse is in distress. If you have a friend that you can sound ideas off, they can take in information for you, give them a ring and see if they can come and help you out. They might just be useful for taking on information that you miss. They can help to hold your horse if you're a bit squeamish. They can also be there to help you if you need any assistance at all. Emergency numbers are a really good thing to have on hand. You definitely want the vet's number. The office number is usually the best one to ring, as your favourite vet may not be on call that weekend. A farrier is always a good idea, and also a transport company if you don't have transport. Not everybody is that lucky, but it is quite good to know of a reliable transport company that might be able to help you out in a crisis. Knowing how to decide whether you need a vet or not is important. Generally, if your horse is in distress, it's difficult to manage on your own. Again, you might need a friend. Equally, a vet is always very helpful. We can come and we can assess the situation on your behalf. We can give drugs if that's needed. If in any doubt, you're always welcome to give us a ring. We're always on the phone and a phone call is free. That is what the out-of-hours service is there for. We can't stress enough how important it is to plan for these things. It's never nice to consider the worst, but if you have a plan in place, again, the numbers that you will have handy, and also just an idea of finances, what your insurance level is like, where the nearest hospital is, whether you would consider treatment. There's also things to consider like concurrent conditions. So does your horse box rest? Does it have a respiratory issue that might mean that's a problem? These are all things to take into consideration, and if you've thought about them before the situation arises, it might help you make decisions on the day, if and when it comes up. So if and when that day comes, when you find your horse has had a bit of an accident, the first thing that will need to happen is you give us a ring. On the assumption that we're coming out to visit your horse, there are a few important things that we all need to know. So first and foremost is, where are you? Sometimes we might be lucky enough that we've been to the yard before, but otherwise a postcode is helpful. In the new age, what 3 words is excellent, or maybe just an obvious landmark near the entrance to the yard. If we can't find you, we can't treat your horse, and that's stressful for you and for us. It's important to know what has happened and what the problem is that you're worried about. However, we can get quite a lot of information when we get to the yard. We just need to know a little bit about it to make sure we can bring the right equipment to solve the problem as quickly as possible. Another thing that's helpful to know on the phone is whether there's any relevant history that might have led to the situation that we're in now. So have you taken your horse to a competition? Have they travelled? Have they been on box rest? These are all things that can help us make a decision sort of while we're on our way, or be prepared for when we get to you. Another thing that's quite helpful is if the situation appears to be getting worse or has your horse settled, it can help us if we happen to have a couple of emergencies at once. We need to be able to categorise where your horse comes in that list. And then finally, do we know your horse? Have we seen them before? So just to go through a few useful things that you might like to have on the yard or a first aid kit ready. This isn't an exhaustive list by any means. You might have something that you find is an essential piece of kit, but just to give you a bit of an idea. So being able to take a temperature is very useful, as is having a stethoscope and potentially a dosing syringe if you speak to a vet and they recommend that you give some treatment. However, we always ask that you don't medicate your horse without speaking to us first, as sometimes it can make the picture a little bit unclear when we get to you. In terms of other things that are useful to have around, being able to remove a shoe is really useful. I have seen lots of makeshift shoe removers, but honestly, a pair of shoe pullers is the best tool for the job and makes your life much easier. There are also lots of good equine first aid books out there. They're a good guide for owners if you find yourself in a situation where you're not sure, and they can give you a bit of guidance, but we'll go through the basics of a few situations in this talk. Also, again, knowing about your insurance cover is really helpful in those situations where referral or surgery might be on the cards. It just allows you to make decisions a little bit quicker if they come up. So, on to a little bit about wounds. Honestly, if in doubt, just give us a ring. Now we can send pictures via WhatsApp and we can have a little look for you, we can give you a ring back, we can always offer you advice on the phone. But as a general rule, a wound near a joint is something that we need to assess in person. It may not have entered the joint, but it is a risk, and these things need to be treated sooner rather than later. Sometimes wounds look huge and gory and awful, and sometimes the bigger wounds actually have a better outcome than the smaller ones that are near those joints and the synovial structures that we worry about getting infected. The best thing you can do is give it a good clean up, lots and lots of water, so just a hose over the wound for a little while. Clean it as long as the horse allows you to, but in these situations, safety is always paramount. If the horse is really wound up, try not to interfere too much. And again, give us a ring, we've always got sedation on hand. If you have a high pressure bleed, apply firm and direct pressure with a clean towel, or you can apply a bandage. You might find that the blood comes through the bandage that you're holding on, in which case apply another layer rather than disturbing the underlayer. As a general rule, any wound that is bleeding from an artery, a high pressure wound, should be seen via vet so that we can resolve the problem as best as possible. Lameness is a really good measure of the severity of a wound. If your horse has a huge wound but is actually quite comfortable, it may not be as bad as a small wound where the horse is, for instance, non-weight bearing, as again we worry about these joints and these tendinous structures that can be infected in that situation. Try not to medicate your horse before the vet arrives. We know lots of people have bute and antibiotics on the yard, but it's always quite helpful for us to get a clear picture before we treat the horse with anything to make sure that we're not missing something. It's very tempting to try and treat a wound with some blue spray or some purple spray, maybe your grandma's magic herbal remedy, but it's quite difficult for us to assess, and these things often don't clean off very well. If you really feel the need to put something on the wound, then Manuka honey is an excellent antibacterial. It washes off really easily and will absolutely do no harm. So if you really feel the need, reach for the honey. So moving on to lameness, most emergency lamenesses will be obvious which leg is the issue, but not all horses read the textbooks. If your horse is non-weight bearing lame or nearly non-weight bearing lame, it's safest to leave them exactly where they are, give us a ring, and we can always come and help you out. We'd always recommend that a horse's non-weight bearing lame is seen by a vet as soon as possible. Causes of acute lameness can vary massively, from a sprain in the field to maybe a fracture from a kick, and different horses will respond differently to pain in different ways. You'll be the best person to decide whether the level of lameness that your horse is showing is a cause for concern or not, but again, we're always on hand to answer the phone. If the injury is below the hock or the knee, providing support to the lower limb with a bandage or a stable wrap can be really helpful in keeping the horse settled and providing a bit of pain relief. But again, try not to give them any bute until at least you've spoken to us and we can make a plan. Again, the cost of a phone call is absolutely nothing, so we're always happy to have a chat. As a general rule, colic is always a cause to ring your vet. There are a few scenarios where a horse might colic mildly and periodically, which the owner is used to managing, but we'd far rather you called us sooner rather than later and we turned up to a horse that was improving, rather than you wish you'd rung sooner. Everyone has heard horror stories about colic, and it is a fair reason to be concerned. Hopefully by ringing the vet, they can come out and reassure you, they can make a plan and talk you through how things are going to work. Cases of gassy or impaction colic are far more common and can be quite happily treated on the yard with some simple medication. However, unfortunately, there are scenarios where your horse may have suffered a twist, a displacement or a strangulation, in which case surgery might be the only option. And again, your vet can talk you through this and how to prepare for the process. Being able to take your horse's heart rate is a really useful skill, as is being able to listen to the gut sounds. So if you've got a stethoscope on hand, definitely feel free to use it, and this is information that you can pass on to the vet when you speak to them. The heart is quite a bit further forward than you anticipate. It is shown on the diagram here with the lovely Buddy modelling himself. It's right by the elbow, and sometimes you need to move the leg forward or you need to move the stethoscope under the muscle mass so that you can hear it really clearly. If you can't hear it, just move it around a little bit and listen carefully. Passing droppings is a really positive sign in a colicking horse. If you have the means to keep a dropping that they've recently passed, that can give your vet quite a good idea of what they might be looking at. They can assess the consistency and whether we might have any worms, something like that. It's commonly said that horses should be walked when they're colicking. This is sometimes true, and sometimes this isn't necessarily in your horse's best interest. If they are mildly colicking and can be walked safely, i.e. they're not going to go down without warning or on gravel, for instance, then you can walk them in bursts and leave them back in the stable for 5 or 10 minutes to have a bit of a rest. If your vet's going to be 45 minutes or so, or longer, then walking them for this amount of time can just be exhausting for them. Equally, if your horse is quite violently colicking and is up and down or thrashing or is unsure of its surroundings, the safest thing that you can do is leave them somewhere nice and quietly so that they're not going to injure you and they're going to limit their injuries to themselves. This might be a big stable, it might be the field, or potentially even the sand school. So the best thing to do is just leave them there quietly and observe from a distance if you can. It's easier said than done, definitely, but you're not much help to your horse if you're carrying an injury as well. So a little look at eyes now, not pun intended. Painful, puffy or damaged eyes are a cause for concern and should be definitely attended by a vet. Sore eyes are very painful by the nature of them and can make a horse feel truly quite rubbish. So if your horse has an eye that is screwed tightly shut, you can put them somewhere out of the sunlight to prevent them from being a bit blinded, but short of this, give us a ring, we'd like to come and have a look at it. Trying to treat an eye yourself, you may have various lotions and potions in the cupboard, but we're quite selective about what treatments we put in different eyes with different conditions, so you're best off just asking our advice. But obviously horses can function very well with one eye, but they function much better with two. And while it may sound quite dramatic to say that they could lose an eye quite quickly, damaged eyes can progress, and we do worry about whether we might not be able to fix them if they go past a certain point. This is due to poor blood supply to the surface of the eye, and also sometimes horses don't love having their eyes treated, which can make it a little bit difficult. So if in doubt, give us a ring. So moving on to choke, important to note that choke in horses is not the same in people. When horses choke, they get the food stuck in their food pipe and not in their windpipe, so they can still breathe even if they're not doing a very good job of looking like they can. Horses react really differently to choke, and they can do quite a good impression of a horse that's about to keel over. They might stretch out their necks, they might tense all of the muscles in their neck, they may cough, they may fly around the stable in distress, and some horses will just stand quietly with their head lowered and drool. Occasionally we see grinding teeth. There's a real big variety, but as a general rule, if your horse has just had a hard feed and then becomes distressed, that's probably what we're looking at. Horses can choke on poorly soaked hard feed or feed that's eaten too quickly. They can choke on a carrot or an apple maybe, but not very often on hay or other forage, or grass particularly. In a lot of situations, choke will resolve of its own accord, usually by the time you've rung us and spoken to us, got off the phone. Quite often we find that the horse has solved the problem on its own. This happens because the food that gets stuck in the esophagus absorbs some water that's in the esophagus as well, and then allows it to be swallowed. But we do occasionally get chokes that don't clear on their own, and we're always very happy to come out and help them out a little bit. So last but not least, foot penetrations. If you happen to be unlucky enough that your horse has stood on something sharp that's gone into the sole of your horse's foot, the most important thing that you can do, if at all possible, is to leave the object exactly where it is and make your horse comfortable without removing the object. The foot contains so many important structures, and it's really important for us to be able to accurately assess where the foreign body has gone so that we can implement the best treatment for your horse. If the object is slightly proud from the sole of the foot, you can place a couple of squash vet wraps either side and bandage the foot so that they can support themselves a little bit. Or if the object is a bit longer potentially and is still quite proud, you can put them in a really deep bed or in a sand school so that they can wait there but without making the situation worse. If you do find yourself in a situation where you have to remove the object, it's really helpful for us if you can take as many pictures from as many different angles as possible, and this means that when we come to have a look at your horse we can sort of make an idea of where the object has gone. It sounds really silly, but once you've removed an object, the hole in the foot closes up really quickly, and so finding the exact trajectory of the object can be quite difficult. As most people are aware, the foot contains the pedal bone, very important structure, but there are lots of other important structures in there as well. So we've got the navicular bursa, the coffin joint, and we've also got the insertion of the deep digital flexor tendon. And if any of these are damaged or infected, that can cause real problems. As a general rule, the closer to the centre of the foot you have a penetration, the more likely it is that we've touched any of these structures and we need to have a full assessment of your horse. So just to round up and summarise with a few important points. Number one is not to panic. 99.9% of the time the problem can be solved in one way or another. There are unfortunately some cases where this isn't possible, but we'll do everything in our power to make sure that's not the case. A phone call is always free. If you have any doubt at all, we're always happy to help over the phone. A little blood goes a long way. Wounds can look horrible and gory, and when they're cleaned up, they will often look an awful lot better. So try not to worry too much. Eyes are always an emergency. We really encourage you not to treat your horse's eye before ringing us, and in best case scenario, we'd really like to have a little look. Finally, preparation is key. Knowing your limits of treatment and finances is really helpful. Having useful numbers to hand is also great, and having some basic equipment that can help you deal with the situation or provide a bit of first aid is really good. Thank you very much for watching. Hopefully you found some useful or helpful tips in here, and please be sure to ring the office if you have any incidents.